Okay, we'll go ahead and get started today. I want to thank you all for joining us today. My name is Nikki Forbing-Orr, and I will be moderating the briefing. Just as a quick reminder, American Sign Language interpretation is available. You can search for interpreter stubs in the participants window to find it. Today, we're going to hear remarks from Director Dave Jeppesen, State Epidemiologist Dr. Christine Hahn, Idaho Bureau of Laboratories Chief Dr. Christopher Ball, and then we'll take questions from media. With that, I will turn it over to Director Jeppesen.
Well, thank you, Nikki, and welcome everyone to our COVID-19 press. Adults and children. The latest numbers are as of Saturday, November 27th. For this past week, we continue to see a decline in the daily average census numbers, with 315 COVID-19 patients on average in the hospital. Cases and hospitalizations in the Panhandle Health District. And testing positivity there has dropped from a high of 23.1% 7 weeks ago to 9.9% as of last week. While things are trending a good direction, I do not have a time frame for when crisis standards of care may be deactivated in the Panhandle Health District. That decision will be made when the surge of patients being driven by COVID-19 no longer exceeds the healthcare resources available up there. And we do monitor the situation daily. Just like all viruses, the coronavirus will continue to mutate, creating new variants such as the Omicron variant. Vaccination can prevent spread and therefore decrease the opportunity for the virus to mutate. That is why the COVID-19 vaccine is now more important than ever. As a reminder, a COVID-19 vaccine is available for children ages 5 to 17. It is a good time to not only get children those ages vaccinated, but to also get the entire family vaccinated. And everyone who has been vaccinated and is 18 and older should get a booster shot, either when they are 6 months after their initial Pfizer or Moderna series, or 2 months after their initial Johnson & Johnson vaccine. In addition, the potential for new variants, such as the Omicron, are good reminders that wearing a mask in public and practicing physical distancing are still recommended practices. And with that, I'll hand it over to Dr. Hahn.
Thank you, Director. For our briefing, and I could give an announcement of what they decided, but they are still in hot debate. Just talking about us getting ready for the antiviral that they are discussing. So first, as far as the Omicron variant, word that I don't think I even knew before a week ago, and now we're all letting it trip off our tongues here. This variant, as you all know, has not yet been detected in the United States, unless it was just announced in the last hour and I missed it. But what I gathered from some interviews I've heard in the last day or so is that I think there are some larger labs that are anticipating that they're going to have a positive. I don't know if they have, Dr. Ball will talk about details of testing, but I suspect it'll be imminent that we do hear that this variant is here in the United States. I'll let Dr. Ball talk more about the lab testing, but of course we are also doing sequencing and work to do surveillance for this and other variants in the state. Additionally, we have good news from the FDA that our PCR type tests in general will pick up this virus, as will the supposed to be the home and rapid and antigen based tests as well. FDA's announcement says that stay tuned. They're going to continue to monitor this situation as more cases are reported. But so far, it looks like our tests that we have in place in Idaho will be able to pick up this variant. We don't, but I want to emphasize one other thing. I've been on a call yesterday with a CDC briefing, a White House briefing, and then today I've been on the call with FDA, mostly focused on this new drug, but also they were talking about the Omicron variant as far as whether this new drug would be effective. I want to emphasize a few things. One is there's more unknown about this virus right now, this variant, than we have known. It is not 100% certain that it is more transmissible than Delta. There's that suspicion and that concern because of this apparently rapidly growing cluster out of South Africa initially and cases elsewhere. But we don't know that for sure yet. We don't know that it's going to be able to take over or displace Delta variant. We aren't sure. We don't know yet how well vaccines will protect against this. You may have heard the Moderna, I think it was the CEO mentioning that he does not believe their vaccine will provide very good efficacy, but they won't know until they do the tests in the lab. Nonetheless, we are, as you heard from the director and you'll hear from me, we do urge Idahoans to use this opportunity to get vaccinated. Even if the efficacy is less than it has been against Delta, this right now remains one of our best protections against these variants in general. And we've seen good protection from this vaccine. We also don't know whether the monoclonal antibodies that we've been using or some of the other medications and treatments that have been effective will be as effective against this variant. So we have to be humble in acknowledging that there's a lot to be learned about this variant and a lot of work going on and a lot that we just don't know. So I wanted to, while we try to stay abreast of the news coming from around the country and around the world about this variant, we are also continuing work on making sure that Idahoans have access to monoclonal antibodies. We're real pleased to announce, some of you may have seen just last week, Salzer Health announced that they now have monoclonal antibody treatment available in Nampa, and we're very excited about that opportunity, just expanding access in Canyon County, where we felt that the access hasn't been as good as elsewhere. Very pleased that we've been able to help support Salzer Health and make that happen. And then, as the director already mentioned, but I'll repeat, CDC yesterday did announce that they are recommending all adults who've been vaccinated against COVID. So anyone 18 and over that's 6 months out of their Pfizer, Moderna, or 2 months out of Johnson & Johnson should get a booster. The previous recommendation was a should for people with certain health conditions, people living in long-term care, or people of a certain age. Now it is all adults that meet the time frame. They are recommending to go ahead and get a booster now. It's a good opportunity before we believe we have any Omicron in the country to use this opportunity to protect yourself. And then lastly, I just want to say another word. I was mentioning already the FDA Advisory Committee is meeting today, and I just want to emphasize that Idaho, we may have an announcement from the committee later today of recommending that FDA authorize this antiviral. This is molnupiravir, and this would be potentially very helpful new drug in the armamentarium fighting COVID. This would be a pill that people could pick up at a local pharmacy if their doctor prescribes it, if they have COVID. And there's been news lately about the efficacy not looking quite as promising as initially it looked in the beginning of the trial. But nonetheless, it has been shown to reduce risk of ending up in the hospital. And Idaho has been working very hard to get ready for that. We are working with pharmacy chains around the state. We're working with the federal government to make sure that we are ready. We'll be allocated a certain amount, and as soon as that is available, if it is made available, if FDA authorizes it today, we will be ready to make sure it's distributed fairly throughout the state. So that's all I had, and I'm going to turn it over to Dr. Ball.
Thanks, Dr. Hahn. Welcome and thank you for the opportunity, Director, to speak to the press this afternoon. I'm looking forward to Idaho. So by way of a little history, during the spring and summer of 2021, Idaho, in conjunction with a number of partners, sequences that we've been able to process. We're currently seeing or processing or sequencing about 9% of the positive cases. And we're getting samples from all regions of the state. And kind of proof that the process actually works is over the summer, we were able to observe the Delta variant sweep into Idaho and completely displace the Alpha variant that predominated last spring. Currently, with all of our sequencing efforts, we're seeing that the Delta variant comprises about 100% of sequences right now. So we're well positioned to identify the Omicron variant as it arrives in Idaho. One of the things that's peculiar about the Omicron variant is that it's much like the Alpha variant that we saw last spring, in that there is a unique PCR profile for certain tests that may give us a sneak peek that it's here. So there's a particular gene target that doesn't amplify, and when we see that particular profile, it's an indication that we may have the Omicron variant present. So yesterday, the Idaho Bureau of Laboratories sent out notification to Idaho Clinical Laboratories to ask them to watch for this particular PCR profile. And if they have the ability to switch methods and use this PCR method that I can identify the variant, we'd ask them to do that for the next few weeks as we await arrival of the variant in Idaho. So I think I feel confident that with the program that we have in place, that when the variant gets here, we should be able to detect it. One of the things that I think has been really positive over the last couple of months, as the director highlighted in his opening remarks, is the declining positivity rate. And this is really good news for us as we continue with the pandemic response. But one of the things that may be a bit counterintuitive is, as we see testing positivity rates decrease, the importance of continuing to test really increases. This is really for two reasons. First, if we can continue to rapidly identify new cases and get those folks into proper isolation, it really limits the transmission of disease in the state, which enables us to continue that downward progression of the positivity rate. Additionally, we still need people that are symptomatic or may feel that they have been exposed to get tested, and get tested using a molecular test, so we can continue to receive samples here at the Bureau of Laboratories to further our sequencing efforts, enable us to do this variant detection. So one of the things that we really want to emphasize in this particular press briefing is that even though we're trending in the right direction, testing is still very important. So as we move into the second year of the pandemic, and I can't believe I'm saying this, One of the things that's positive coming out of that is the testing landscape has changed dramatically from where we started back in March of 2020. There are substantially more testing options available to folks. So as a refresher, I thought I would review that there's really two general types of tests that can be used to detect a COVID-19 infection. One is a molecular test, or commonly referred to as a PCR test. And this is a very sensitive test that detects specific parts of the SARS-CoV-2 genome. It's usually conducted in a laboratory. It generally costs a little bit more, and it can have a slower time before you get your results, but it can be effective at detecting an infection through a longer period of time. Additionally, positive results are reported to the state so that we can track the progression of the pandemic. And these positive samples are the ones that can be submitted to us for sequencing so that we can determine the variant that is causing the infection. The other type of test is an antigen test, and this is a test that detects SARS-CoV-2 proteins. It's less sensitive, but it's best utilized for folks that have symptoms. But the advantage of this is it can be conducted either at the point of care, in which case it will be reported to the state, or it can be conducted at home, in which case those results will not be reported to the state. The cost is substantially lower, and you typically will get results within 30 minutes. One of the downsides with antigen tests is, although they're very convenient, the samples are self-destructive, which means they can't be used for sequencing. So one of the things that you should consider if you are seeking testing is that molecular testing is available at almost all healthcare providers. It also can be available at many pharmacies, and there are also some retailers that will sell tests that you can collect at home and then mail into a laboratory. All of those results will be reported to the state, and we may be able to access those for sequencing. In addition, recently there have been several pharmacies that have federal funding that may be able to provide free testing options, either molecular testing or antigen testing. I know for certain here in the Treasure Valley area and through other areas in the state that Rite Aid, Walgreens, and other pharmacies have the availability for people to come in and get free testing. Additionally, Idahoans may request a free test from the state of Idaho by calling the 211 care line. These are also molecular at-home tests. They will be taken with the assistance of a telehealth proctor and then shipped to a laboratory for testing. And you'll probably expect to get results within 24 to 72 hours upon receipt from the laboratory. So it's a bit slower than the rapid antigen tests. On a positive note, antigen test kits are becoming increasingly available for purchase at pharmacies, grocery stores, and through online retailers. And to make sure that that continues moving forward, the federal government has signed contracts with several manufacturers to boost their production despite the ebbs and flows of positivity and spikes in demands of the pandemic. So we won't have testing shortages that occurred when we got hit with the Delta wave. To kind of wrap up, I thought I would do a little bit of a forward look. First, I'd like to give a big thank you to the many partners that have assisted us at the Department of Health and Welfare and the Bureau of Laboratories, our own bureaus within the Division of Public Health, our partners at universities both within the state and around the country, the CDC and their federal partners, private sector laboratories, healthcare centers, long-term care facilities. We continue to really look forward to providing services for Idaho's most vulnerable populations in long-term care, correctional facilities, and also assisting with development or enhancement of testing in schools. So with that, I'll turn it over to you, Nikki, for questions.
All right, thanks, Dr. Ball. So we will now we'll open it up to questions from the media. Please raise your hand in WebEx or type your question into the chat area. When I say your name, go ahead and unmute yourself and announce your name and media outlet before asking your question. And then please remember to clear your hand when you're done. So I think I saw Audrey Dutton had her hand up first, so we'll start with Audrey today.
Thank you. This is Audrey Dutton from the Idaho Capital Sun. My question is for Dr. Hahn. You mentioned that Idahoans should still get vaccinated if they haven't been yet. And what's the reason for people needing to get vaccinated now if we've heard from one of the vaccine manufacturer's CEO that he's publicly skeptical about his own vaccine being as effective? Should people wait for one that they know works for Omicron?
Yeah, thanks, Audrey. It is a challenging time. I think Moderna, as you probably heard, Moderna and Pfizer are already working on evaluating whether they're going to need to come out with a different vaccine for this new variant or not. It'll obviously depend on two things. One is how well their current vaccines work, and number two, whether this variant really takes off, which we're not 100% sure it's going to keep spreading like it is. So I think, to me, as I think about it, I think of it a little bit like a seatbelt analogy. Right now, first of all, right now we have Delta, and we still have a fair amount of Delta, despite the good news that the director highlighted. We are still have significant transmission in Idaho. Many of us are planning holiday festivities that are, still coming up. And this is a good protection for what we have in Idaho now. So we really urge vaccination for what's out there right now. But also, even if the vaccine is not as good against the new variant, and we just don't know yet, but even if it's not as good for at least a short period of time, that's all that's going to be available. It's going to be your best protection against that until manufacturers have time to rethink the vaccine potentially or re-engineer one. And I do think that, again, I think of it kind of like a seatbelt. If you told me 90% chance it'll save your life, oh, absolutely would all put a seatbelt on. But if you say 10% chance less of getting injured, I'd still do it. Even if it's a lower effectiveness, it's still my best bet to protect myself. And I would still do it with a lower efficacy. So I think the message is twofold. One is Delta's out there right now. It's still circulating. It's still a threat. Do it now to protect yourself from what we know is in Idaho. And number two, for the moment, it's the best vaccine we have.
Okay, thanks, Dr. Hahn. Our next question is going to come from Selena Van Heining.
Thank you, Nikki. Hi, I'm Selena with KTVB. I'm not sure who this question is for, so I'll let you fight it out amongst yourselves. Over the past several months, we've seen a lot of, I guess the best way to call it is alternative treatments for COVID in the form of oral pills, monoclonal antibody treatment, and things like that. And what we've seen kind of around Idaho and around the country, I guess, is doctors and pharmacies experiencing a shortage of certain medications that can also be used to treat COVID. Most recently, we've heard from people that a drug that can be used to treat rheumatoid arthritis is now in shortage. Is that something that we're seeing in Idaho? And if so, are there any plans to kind of combat that?
Well, thank you, Selena. And I'm going to play the question quarterback role today since Elke is out. And I think we'll hand that one to Dr. Hahn.
Yeah, thank you. I'll tell you, I have not heard of that particular shortage, but as you mentioned, we have intermittently had some shortages. There is one tool and that we used early on in this pandemic that some of you might remember, where the Board of Pharmacy can place restrictions on the prescribing or of certain drugs. And if there's a potentially life-saving medication that is in shortage, they can do that. But that is something that I think the board and we would reserve for an extreme situation if truly it comes into shortage and people need it for severe conditions. Short of that, the best tool we have right now is continuing education and reminding people and providers of which drugs have been shown to be effective. There are some, of course, the National Institute of Health has some guidelines out there, treatment guidelines, but for those that would rather use a non-governmental source, I personally prefer the Infectious Disease Society of America's guidelines. They're an independent, they're a group of infectious disease physicians. They have a very nice guidelines out there with a very nice color coding, green, yellow, red kind of a this drug works, this drug we really don't know, and this drug should not be used. So that's our best tool right now, is educating not only the public but providers about what medications have been shown to be effective and which ones are recommended and which ones might actually be unsafe.
Okay, thanks, Dr. Hahn. Our next question is going to come from Nicole Camarda.
Hi, this is Nicole Camarda with Idaho News 6. Obviously, no one wants to hear news that there is a new variant. Even though we don't know much about it at this time, are health officials in Idaho, speaking of you guys, concerned about this new variant because Idaho's vaccine rate really hasn't increased too much over the last few weeks or even months? So is this something that you do see as a concern, or do you think Idaho has learned enough over the last few months to kind of combat this when it is detected?
Well, Nicole, I think I'll hand this to Dr. Hahn, and I would just say that we are concerned about any new variant that emerges. As Dr. Hahn said, we know less about this than we know about this new variant. So really the next couple of weeks will tell us if this variant is a threat and how much of a threat it may be. But I'll hand it over to Dr. Hahn to fill in the blanks there.
Yeah, Director, you said it very well. Yes, we are concerned. We, of course, have been watching each new variant and don't know in the beginning how serious it's going to be, but we know our vaccination rate is not where we would like to see it. We know we have people even that were vaccinated, but it might have been a year ago now and haven't gotten a booster yet. So we are trying to use this opportunity to remind Idahoans that there is an opportunity now before this variant makes an appearance to consider get in now and get your vaccine if you haven't already done so.
Okay, we'll move on to our next question, and that's going to come from Kyle Fonenstiel.
Thanks, Nikki. This is Kyle from Idaho Education News. After the vaccine was approved for young children, multiple schools in Idaho ended their mask mandates. And I know we're in a state of flux without knowing much about the new variant. I'm wondering first, when will we know more about the new variant? And in the meantime, what sort of stopgap measures should schools take to protect kids?
Kyle, thank you for the excellent question. For the last part of your question, the recommendations remain the same, which is our best tools are vaccination for those 5 and older. And for counties which are moderate or high amounts of spread, I think I missed it, substantial or high spread, the recommendation is for kids to wear masks while they're in school. And most of the counties in Idaho remain in that either substantial or high status. But I'll hand it over to Dr. Hahn for the first half of your question.
Yeah, Kyle, what we're hearing from Pfizer and Moderna and from other labs around the country that are is that they are thinking in a few weeks we will know more. For example, they'll have their work done on at least whether the virus appears to be neutralized by antibodies created either from their vaccines or also from people who've naturally recovered from the infection. One thing we haven't talked about yet is that people who've had COVID and thought, oh, I've had COVID, I'm pretty good right now. It's still Delta. That's what I had. This might also impact those people if they've got some protection from having had Delta. It's not clear at all whether they will still have that amount of protection against this new variant. So a few weeks is what we're hearing, and so we're going to have to hope that is correct. I don't know if Dr. Ball has heard anything else from his laboratory side of things, but that's really what I'm hearing from the manufacturers.
Thanks, Dr. Hahn. I think we're hearing very similar information, just a lot of uncertainty as to the ability of this new variant to be more transmissible or as transmissible as the Delta variant, and then also looking forward to those neutralizing antibody studies as well. So I think we're hearing all the same information. I think if we can just be patient for a few more weeks, we're going to have a lot more information.
Okay, our next question is going to come from Jack Schemmel.
Hello, this is Jack Schemmel with KMVT. I believe this question will be for Dr. Ball. You referenced the fact that we have the resources to test for the new variant based on the fact that basically all of the strain in Idaho right now is Delta. So would that be a thing like tomorrow, those tests out there tomorrow would be able to kind of detect that, or is there maybe a grace period in terms of how long maybe people that are administering these tests can kind of figure this out?
Dr. Ball?
Well, thank you for the question, Jack. There's always a bit of a delay between folks getting tested with a molecular test and that sample getting submitted to the laboratory for us to do the sequencing on it. I think, as I mentioned in my remarks, one of the things that's at least encouraging about this new variant is that we may get a hint that it's in town when we see this particular PCR profile for a test that's fairly widely used at some of the major testing laboratories. That being said, once we determine, or if we see that signature and those samples get forwarded to us, we're probably looking at least a week before we'll know if it's here. So there will be a bit of a delay. I think, as the director and Dr. Hahn mentioned, if we can continue with our, the public health prevention mitigation efforts that we know work, that's the best thing that we can do moving forward while we wait for this additional information to come in. So that's get vaccinated if you haven't been, make sure that you wear a mask when you're out in public places, and distance, and get tested if you're feeling ill.
Thanks, Dr. Ball. Our next question is going to come from Keith Ridler.
This is Keith at the AP with a question for Director Jeppesen. Director, what would you say is the primary challenge facing the state as it awaits what sounds like the inevitable arrival of Omicron?
Well, thank you, Keith. You were fading out a little bit there, but I think you asked what's the biggest challenge that we face as a state as we wait for what may be an inevitable arrival of a new variant. Did I get your question right, Keith?
Yeah, that's the question. Yes.
Okay, thank you. Thank you. Just we're fading there a bit, so I want to make sure I got it. I think our challenge remains the same, which is to encourage those that haven't been vaccinated to do so. And for those that have been vaccinated and are eligible to get their booster shot. We have seen quite a number of booster shots being given over the past, since they've been eligible here in the past month or so, which is great news. And there's more people eligible now with some of the changes to 18 and older. So that's really our biggest challenge, is to continue to encourage those that haven't been vaccinated to do so, and those that have been vaccinated to get their booster. What we do have going for us is we do have a very good infrastructure in monitoring our healthcare capacity across the state, and that remains, and that will be very helpful if we do happen, and I'm really hoping we don't, but if we do see another spike in cases. And as Dr. Ball articulated so well earlier in his remarks, we are in a much better place around testing, which is really our ability to understand what's happening, to understand quickly what's happening, so we can take appropriate steps and make appropriate recommendations to the public. So we have some things going in our favor and some things we need to keep working on.
All right, thank you, Director Jeppesen. Our next question is going to come from Ian Stevenson.
Thanks, Nikki. This is Ian with the Idaho Statesman. So one thing I've noticed over this current, most recent surge is that the death rate in Idaho due to COVID has been ticking up marginally. And I wondered, so as you all have said for a while, there are still lots of Idahoans who are unvaccinated, which gives ample opportunity for the disease to continue to spread. But a lot of very sort of more vulnerable older Idahoans are vaccinated. And so I wondered if, in addition to Delta being more contagious, is that increased death rate likely attributable to an increased virulence of the Delta variant, or might there be other things at play that may be causing that?
Ian, that's an excellent question, and I'm actually going to hand that to Dr. Hahn.
Yeah, thank you, Director. Ian, yes, we have been struggling to understand why we've seen the number of deaths that we have with this recent surge. I think that was a surprise to us. Absolutely, we have a number of Idahoans that are not vaccinated. And as the director has faithfully reported, I think on every briefing, the vast majority of our deaths have been in unvaccinated individuals. That said, we still thought we'd maybe have enough folks vaccinated, that we wouldn't see some of the deaths, for example, in some of the long-term care facilities, and we thought we'd see some protection even among unvaccinated individuals. So I would say that we don't understand exactly why. I think we've reported previously it's been a little bit of a younger population. You know, the average age of folks dying has been a little bit younger, meaning that although we continue to see some deaths in advanced, folks in their 90s, that kind of thing, we are seeing more deaths in people in their 40s and 50s, and we've talked about that before, which certainly is worrisome, especially because these are in populations with lower vaccination rates. That's why we keep pounding the message, especially really our what I think of as our older, middle-aged, our folks in our 40s and 50s that feel like they're still healthy, and why do I need to do this? We are seeing more deaths in that age group, and I think when we look at the death certificates, a lot of times they have obesity or hypertension, diabetes, lung disease, that kind of thing mentioned on the death certificate. So we know as people get older, they're more likely to have some of these comorbidities, and that puts them at high risk. But I think these people don't view themselves as high risk. I think seniors have gotten the message, and they are getting vaccinated at very high rates. Even in Idaho, we have really pretty good rates in our seniors. But I think it's that middle-aged population that doesn't see themselves at risk that we are really trying to get through to now and encourage them to go get vaccinated.
All right, thanks, Dr. Hahn. Our next question is, we're going to start a round of second questions here, and the first one's going to come from Audrey Dutton.
Thanks. These questions are for Dr. Ball. I have one quick question and one longer question. The first one is the PCR profile that you're talking about, is that the S gene drop off or dropout that was a red flag for alpha? And if so, have you been able to be in contact with all the labs around the state and ask them to go back and look for that red flag?
Go ahead, Dr. Ball.
Thanks, Director. Thanks for the question, Audrey. Yes, that's exactly what I was referring to in my remarks. So this strain, like the alpha strain, has a particular deletion in the spike gene that causes that one target in that PCR method to not amplify. And so that's a real tip-off that we may have something new, that the Delta, that's not the case with Delta. So if we start seeing an increase in these S gene dropouts, that may be an indication that the Omicron variant is in the state. We'll have to verify that through sequencing, and so that'll be the sort of a two-stage process. So to answer your question, your short question longer, yes, we did send out notification to all of the laboratories, even those that we know aren't using the TACPath method. Just so that they can be on the lookout and spread the word through the clinical laboratory community. And then we've reached out to labs that we know are running that assay, personally asked them to submit samples. And then we know that there are some laboratories that have multiple methods, and we've asked those laboratories that have the TACPath method among their methods to see if they could switch over to that method, at least for a subset of their positive tests, just so that we can hopefully get an advanced preview if the Omicron variant comes to town.
But no red flag S gene dropouts.
We haven't had any reports of S gene dropouts yet. Most laboratories, once we send out these notifications, our own laboratory included, will do a retrospective look back to make sure that they haven't seen anything in the last 2 weeks. But one of the things that most of the labs that are running this method are pretty key to see that. And if they see it, they will report it to us and submit those samples for sequencing. That's been the case since the alpha variant hit in the spring. We've been using that S gene dropout as kind of a prioritizing criteria for sequencing.
And then my other question, maybe longer, maybe not. How does our sequencing in Idaho compare with other states or nationwide? It sounds like we have quite a lot of participation. I'm just wondering how that stacks up.
Dr. Ball?
I think when we look at CDC produces a report every week that looks at the prevalence of SARS-CoV-2 variants nationwide. And when you compare Idaho to all the other states, I would say we're very comparable to the vast majority of states. So unlike some other metrics where we're not doing as well, I'd say we're really holding our own when it comes to sequencing.
Okay, thanks, Dr. Ball. Our next question is going to come from Kyle Fonnensteel.
Thanks. I just wanted to ask the second part of my question again. Many schools have been lifting their mask mandates after the approval of the vaccine for children. Are there any measures that they should be taking now in light of the new variant to protect kids?
Oh, great, Kyle. Thank you. Sorry we missed that the first time around. And I'll hand that over to Dr. Hahn.
Yeah, thank you, Kyle. As you know, so little is known that we would just recommend for now what the director mentioned, which is that kids going to school, we believe are safest if they're wearing masks, if they are vaccinated, if they're eligible, which most school-age kids are. And of course, if the schools are taking, precautions, trying to, I know in the wintertime it gets a little tougher to do the ventilation, but keeping as much as possible, good ventilation, spacing between the kids, good, hand washing, that type of thing, to try to keep the kids safe. So we would just kind of double down on our same recommendations for this variant until more is known. As far as we know right now, those would be the same measures that we would recommend against this new variant.
Okay, thanks, Dr. Hahn. Our next question is going to come from Selena Van Heining.
Hi there. This is probably a question for Dr. Hahn. I may have missed this. I had to step away for a moment, but it looks like the FDA panel did go ahead and endorse that COVID-19 pill. So in terms of Idaho hospitals, pharmacies, what's next now that it's been approved by the FDA panel?
Dr. Hahn?
Thank you, Selena. I just saw the Washington Post, which is always, I swear, they're the fastest. I just got that a minute ago, so you're very quick. So yeah, it looks like they just did, in a narrow vote, no less. I thought it was going to be a little controversial, recommend authorizing the pill. So really the next step is going to be, of course, the FDA. This is just their advisory committee. So now the FDA will take that advice and they may come out immediately and say, yep, we're accept it, or they may take some time, take a few days to come out with their final authorization. They may have, there are a lot of discussions. For example, this is not recommended for children, first of all. It is not recommended for pregnant women and things like that. So there may be some tweakages that they need to do before they issue a full authorization. Once they have authorized it, though, unlike the vaccines that go over to CDC for their vaccine advisory group, that step doesn't need to happen. This is a drug, a medication that the FDA authorizes, and it is ready to go. So what will happen next is we will hear from the feds how much has been allocated for Idaho, and then we will be putting in we'll be told how many doses we get. We've been told it might not be a lot right away. And we've worked very hard with partners, including pharmacy chains around the state, to try to get them. They've been also told by the feds to be ready. And so we will work with them to try to allocate it fairly throughout the state and hopefully have it ordered as quickly as possible. We don't want any delay on our part to slow anything down. The other piece that we need to do now, after we read the FDA's authorization, make sure that we understand that, is get that information to providers. They will, of course, hear about it as well, but we need to make sure providers are aware of this new option. Many of them are already aware of the monoclonal antibodies that are by IV or by subcutaneous injection that have been going on now for months in the state. This will be a new option that we need to make sure providers are aware of, including who should get it, who should not be prescribed this, et cetera. So there'll be a little bit of a time before I think this is all up and running, but we're committed to making sure that we are moving as quickly as we can.
Okay, our next question is going to come from Ian Stevenson.
Thank you. So while the positivity rate in the state fell last week, it looks like it fell a little bit slower than the rate it's been falling, the rapid rate it's been falling in recent weeks. And I know this is difficult to predict, but I wondered if there's any indication that we may be starting to enter some sort of plateau, or whether it looks like we're still seeing pretty rapid declines in caseloads and positive tests.
Oh, thank you, Ian. We also have noticed that we were almost on a perfectly linear path of dropping almost a percentage point a week, which was actually uncanny and unusual. And we did notice it did decline, as you mentioned, but was not quite as much as it has been in the previous 9 weeks. So it's really hard a single data point doesn't make a trend, and any further decline will take. We have observed in the past that as we get closer to 5%, that decline starts to ease off a little bit. And we're really hoping it's not an indication that we're hitting a plateau or even a turnaround point. But we have no indication that it's about to turn or that's a turning point. It's just an indication that it's declining, not as quickly as it was previously. Dr. Hahn, anything you want to add to that?
Yeah, Director, you said it absolutely correctly. We hope not, but we're realistic, and we know that the states around us are seeing increases. We're not immune from that, and I think we are concerned that we might be starting to see a plateau. We just don't know it yet, but we are concerned that that's what's happening. Yep.
Okay, we have another question from Audrey Dutton.
Thank you. I am wondering if, as we've seen the polarization around vaccines in COVID-19, have you seen any changes in vaccination rates for other vaccines, any kind of creeping vaccine hesitancy into flu, childhood immunizations, stuff like that?
Audrey, excellent question. I believe we have Sarah Leeds on the line. Yes, I see she's there. So Sarah, I'm going to hand that to you.
Thank you, Director. We have seen a significant decrease in flu vaccine uptake this season. It is not particularly surprising given trends that we see each year. When last year the flu cases were down, and we usually see a decrease in flu vaccine uptake after a season like that. We're not sure whether, we haven't done any surveys of the public to see if there's some other factors in play regarding that. We have seen some small decreases in routine pediatric immunizations, but those we're right now attributing to the catch-ups that we need to do after last year. So we are hopeful that most parents do get vaccinated, and we're hopeful that those who need to get their kids caught up will do that. So, we continue to push for higher vaccination rates within the program, and continue all the work that we do every year to increase education about the need for routine vaccines, and of course influenza every year. And so that work continues in and out of COVID.
Thank you.
Right, I don't see any more hands raised, so we'll go ahead and wrap it up for today. Our next media briefing is going to be in 2 weeks on December 14th. Thank you all for joining us today.